So you seem pretty exasperated, rightly so.
Yeah.
And I'm wondering if you could bring us through your thought process. People had a lot of buy-in in March, April, and May, and you have done incremental, as you said, trying to do more restrictions. What in your mind convinces you that a lockdown would actually be significant in terms of fighting this, and as opposed to just it's going to decimate business, obviously. But give me the thought process about that if you do go to a lockdown, and that's what everybody's hearing here, oh my goodness, lockdown, how is that where we are now as to where we are in the spring? You need more buy-in, so how do you get that?
Yeah. So a few things. Before I get there, I'm watching to see if any of this takes effect. So we're measuring mobility. Are people actually home after 10 o'clock? We're seeing, are the restaurants empty after 10 o'clock? So if we start to see more of that buy-in, then we can avoid a lockdown. The truth of it is, if there's no reason to go out, the stores will close. Restaurants will be forced to shut. That's the thing about this. We are getting good compliance from businesses, schools, retail, and if they're ordered to close, they'll close. And then people will, I think, get a serious message and will stay home. And by the way, you see it in other places. I mean, sadly, lockdowns do still continue to work. The thing that we're struggling to get a handle on is everything I keep talking about, these informal gatherings. But, if church isn't open to go to church, if you can't go to Mass, you have to do it virtually, and you will stay home on Sunday. So that's my thinking. I'm also thinking about how testing, we have more levers at our disposal right now. So we know, for example, people just aren't quarantining when they're told to quarantine. Hey, you ought to stay home for 14 days, you were close contact. Okay, thanks, bye. They go out, play soccer. So, and we're spending a lot of resources on trying to find those people and get them into quarantine, and I really wish they would continue to quarantine. Maybe there's better technology solutions that we can find to enforce quarantine, ping people constantly. Maybe we need to be focused more on more testing. So what am I trying to say? It's different than April. People are tired. I'm not just going to rely on a lockdown. I'm also looking at new technology, new testing protocols, new rapid testing, and also lockdown. But where we are right now is we're overrun, and we might just need some blunt instrument to settle things down. I may not have a choice. Like, nothing seems to be working right now. So, yeah, I mean, I can't see how we would not have a Thanksgiving lockdown. Stay-at-home order, if you will.
Governor, in regards to schools, parents are scared, teachers are scared. We're here saying every day there's new record-breaking numbers. There's a Harvard Global Health Institute, their data, and the White House task force data suggests Rhode Island should be at remote learning. Is there going to be a point where you just say we have to flip the switch? You mentioned that you're coming here one last time, sort of hinting that this is your final straw. So I'd like to hear from you on, do you think that this is going to change? And from one of the doctors, do you guys think it's safe to have kids in school as well?
I may put you on the spot since we were chatting about this, so I'll give you a minute to think. So listen. There is not a shred of evidence anywhere in any country, in any state, that school is a vector of spread. Furthermore, we know that the risk for children of getting severely ill is so much lower. Dr. Ashish Shah, an expert, I met with him the other day, and he said at the beginning, he was nervous about in-person, and now, having looked at all the data for the past several months, not just here but everywhere, he is convinced staying in school for as many kids as long as possible is the right thing to do, as long as we have, testing, cleaning, mask wearing, contact tracing. I'm not saying go to school regular, but we have enormous precautions put in place. The thing about school is the downside to children. When people say to me, shouldn't we just go home? It's really hurting kids. And then finally, we see almost as much virus in the kids learning at home as the ones in school. So it's not like it's a flip the switch, because they're not actually just staying in their room. Yeah. Which of you guys?
So I agree with the governor. When we see patients in the emergency department, we're not seeing tens, dozens, hundreds of little kids from schools coming with COVID-19. We're seeing older teenagers, young adults, and elderly patients. So if the schools were a large cauldron of spread, we would be seeing a percentage of those in the emergency department, and we're not doing that.
You're seeing multiple school districts just in the past couple days, Charahoe, Coventry, Cumberland, Cranston, West Warwick, moving in some form to distance learning, and in part saying that contact tracing is delayed again. I know we've talked about this, but are just the sheer numbers now cracking the system, and is that system overwhelmed, even though the schools may not be a spread? Are there just still too many cases?
Yeah. So I think no, the sheer numbers are not too overwhelming. There are many schools, this is hard for schools, okay? I won't sugarcoat this. There's a lot for schools to do for it to be successful. When someone's positive, they have to send us an Excel spreadsheet with seating charts so we know the close contacts. They have to send us bus seating charts. By the way, I do want to make that clear. That's not just in Rhode Island. That's what's happening all over the country. That's kind of best practices for what schools and school districts have to do. So are some of them getting overwhelmed with that? Yes, absolutely. It's really hard. But by and large, I would say no, they'll be able to keep up. And I also think it's fine if they want to take a few days off. Cranston, for instance, they're taking a few days virtual. Monday was a professional day anyway. They're using a few days to get organized, clean. I think that's appropriate. Take a few days off here or there, get yourself settled, get your systems in place, and then get the kids back in school. As many children in school as long as possible is the name of the game.
And Governor, some of those schools are saying to us, though, that they're having trouble kind of hearing back from the health department. I mean, there might be these delays with the contact tracing, and so they just kind of have to go ahead and make these decisions. Mm-hmm. Do you feel like that is appropriate, or do you think there needs to be sort of better communication there?
Both. I think that we need to get better, and we are. The volume isn't very intense. We're actually moving to a model where we're going to let the schools have some more ability to move faster, in coordination with the Department of Health. But sometimes they're frustrated, and I don't blame them, that they're waiting on us and when they know what to do. So we are hearing them, and we're going to move to that model where they send us what we need, we go through some process, and then boom, they can communicate with the parents. So I think it's going to get better and better and better.
Governor, you mentioned healthcare workers would have priority for vaccines. Would they be required to take them?
So there's really no way to require this. It's like anything else, and we've gone back and forth around this. And you may want to hear from Dr. Alexander Scott, who's an expert. Some states are doing the require approach. Actually, some states, I think Massachusetts, the governor did an executive order even in the flu vaccine. While I'm not criticizing that, we're not going to take that approach. We feel the better approach to get to high compliance is to make it easy to get versus to force people. That's what we've always done with the flu, and we have found it to work. So rather than force someone, I think the right way to do it is to make it super easy, make it free, and give them all the information they need so it's not scary. So that's Rhode Island's approach, and that's what we're going to do.
Dr. Foreman, if I could ask you a question.
Do you want to enter that?
Oh, I'm sorry.
You want to hear from her?
If you...
Yeah, the governor answered that well. We have proven techniques that show that Rhode Island is a leader in immunizations. We're going to leverage that infrastructure, that success over time to really roll out the COVID vaccine in a way that is thoughtful and targeted, so that we really get at our highest risk communities in the way that works best for them. And what we've seen in Rhode Island is we can do that effectively without necessarily mandating it across the board. So we will be working on that.
Dr. Foreman? First of all, thank you for your very powerful and obviously very personal testimony just a few moments ago. I wonder if you could take this moment to, all the Rhode Islanders who are listening, there is a significant body of Rhode Islanders who believe that a disease with a sub or around 1% fatality rate, that all of this represents an overreaction, that the limitations being placed on business are far worse than the impacts of the disease. I'm sure you hear that in your professional life every day, anecdotally. What do you say to them?
I say I wish that they could see what we see every day. I wish that they could spend 10 hours in the emergency department diagnosing people with this disease, trying to save the life of people with disease, trying to treat a disease for which there is no cure, and feel how futile and helpless that is. I wish that they could feel what it's like to tell someone they have COVID-19. I wish that they could feel what it's like to have to call a family member on their own personal cell phone and say, I think your mom only has a couple more minutes left. Do you want to see her before she dies? And hold your cell phone up in the room. I think if you could live this, a 1% fatality rate is far too high. You know, we have done drastic things in this country for far lower fatality rates. I know that this is a big sacrifice for all of us, but it's a short-term sacrifice for massive amounts of good for our population. So I think we have to think about this in terms of not just the personal risk to ourselves, but what risk are we putting everybody else around us at? What risk are we putting our grandparents at? What risk are we putting our neighbors at? What risk are we putting the checker in the supermarket at, or our kid's teacher at? You know, we have to think beyond our own selves and think about all the people this is affecting. I think one of the things that we found in the emergency department is that, you know, many of the patients when they first come in may not have known somebody who has died of COVID-19 yet. All of us do. But once you know and once you hear these stories and once it becomes personal, that less than 1% fatality rate becomes far too high. So.
Has enough attention been paid to the non-fatal after effects of the disease, whether it be in the general media or even from state government?
That's a great question, and I would say absolutely not enough yet. What we are seeing is that some people do have mild disease and recover fairly quickly and make a full recovery within weeks to months, but there is a growing body of evidence around this post-viral syndrome, and we don't know enough about it yet. We've all seen a lot of effects from COVID, people having strokes, people having blood clots, people having a lot of after effects of the disease, and this chronic pain and chronic fatigue and chronic trouble breathing that's really debilitating a big segment of our population, people who were previously healthy and young people. So I don't think that word is out there enough yet either. I think a lot of people think, oh, it's sort of like having the flu and then you get better. This is not the flu. This is a different thing, and we don't know yet what determines whether you are one of the lucky ones who gets to get totally better within days to weeks to months, or whether you are one of the ones who will get actually sick and chronically sick from this. And we also don't have enough evidence yet, because the pandemic is still so young, about how long this will last. This may be a lifelong syndrome that people are living with that's completely debilitated.
Dr. Foreman. Alexander Scott, I have two brief questions for you, if that's okay. One is the testing availability. Right now, there was a line outside Dunkin' Donuts Center. Traffic was stopped. It's taking days for people to get appointments. What's the testing availability right now?
It's something that we are working directly on. We recognize the need for increasing access for people who have symptoms. We're opening up an additional site for testing, and we have an added focus on our community's highest hit. We're looking to use, as the governor shared, additional testing technologies, our rapid testing that we've received. We're working with community-based organizations and making sure that there's access available in our high-density communities for doing that. So there's a definite focus on expanding the testing availability as it is.
As for the spike in nursing homes, I know that the governor mentioned trying to divert some patients from the hospital to these nursing care facilities. Can you speak to the nursing home spike there, and do you have any further restrictions on the horizon to try to clamp that down?
What we've seen in nursing homes is mostly a reflection of what we have seen in the community. cases are rising in the community. Many of the people who work in nursing homes are from the community, and we are starting to see the spillover into the nursing homes associated with that. However, as noted, we have the systems in place and ways to be able to address it that we did not have previously. We are a state that has been doing ongoing surveillance testing of our staff and residents in nursing homes. We're continuing to work on ways to support cohorting patients in nursing homes and making sure that the adequate PPE is available in nursing homes. We recognize it is challenging, and we want to continue the partnership with nursing homes. We appreciate what the leadership has been focused on and what's being done. We want to make sure nursing homes have what they need so that we can continue to ensure people from acute care hospital settings that no longer need to be in those hospital settings can be moved to appropriate settings in the skilled nursing facilities and make it so that we continue to have the capacity that we need in the hospital settings. That's an ongoing partnership. It's something that we're also focusing on with them.
Director, what do you say to people's concerns about hearing that now more people could be moved into nursing facilities who are hearing that and are concerned despite the fact that I think the governor said they'll be tested twice before they go?
It's the people who are concerned about it, we understand that concern, but we want to make sure they hear about the systems in place to help ensure the safety of people as they're moving into nursing homes. And the biggest key is having people placed in the environments that are most appropriate for them. We want to make sure we don't continue to have people who would do fine in a skilled nursing facility continue to take up beds in a hospital, acute care setting, and make sure that they are appropriately placed safely in the settings where they can be cared for.
Just to follow up on the field hospital, I know we've heard the time frame could be days, could be weeks. How do you know when that's going to happen? I've been told that there's no hard hospitalization number. I think the governor said the surge capacity is 600 beds. How do you know when it's time to switch over and the hospitals themselves are overrun?
It is a cumulative approach of a number of factors. You look at acuity of cases, you look at availability of beds that are in place, you look at the trends and what the models are showing, we look at what the partnership with the hospital leadership reveals to us. So that we have in place and will continue to follow closely. We've also worked towards activating the Healthcare Coordination Center so that we can better coordinate across the hospitals that may have more beds available. That will help delay the time to the extent that we can of going into an alternate hospital site, accessing this coordination approach so that we can make sure that all of the beds in the current hospitals are filled as well.
What is there a rough number, 500, 600 when we see that number at 220 patients? Just so people know, I mean, what we're talking about, and I know it seems like kind of a moving target, but is there a rough number?
It is a moving target because it differs across the hospitals. We know in our Providence County, for example, the hospitals are further along. So I'll refrain from giving an exact number. It's similar to what we have been saying with the percent capacity, as well as the other elements that I've shared.
Doctor, can you touch on, if the numbers are going up, I am hearing from a lot of people that are having a tough time getting a test. And if we're increasing, I would think the wait's just going to be larger. Is that something that needs to be addressed and maybe opening more testing centers?
Absolutely. It was what I answered earlier. Our focus on increasing testing capacity is a priority, particularly for our communities where the test percent positivity is higher. That informs us more testing is needed in those communities that are harder hit. What we shared today in terms of the results portal is a key step, and technology really supporting what's needed, because a critical factor is people being able to easily access the results of their test, and for everyone to continue to hear the message about what to do when you have a positive test result. Regardless of the system, we are at a place now in this pandemic where with shared responsibility, people don't need to wait to be told what to do. If you have a positive test, you need to be at home. What we call isolation is really just staying at home and recovering there. Making sure the people in your household also stay at home. We call that quarantining. They should not be going out to work or to other places because they need to monitor themselves for symptoms. The people in the household need to continue to stay separate from each other to the extent that's possible. We want to continue to make housing opportunities available, hotels or others, for people who are not able to separate in their own homes so that we can minimize spread within hospitals. And people who are positive can know about calling the people who were close contacts with them. If you have individuals that you know you spent 15 minutes or more in close contact, less than 6 feet from them, you can call them when you have that positive test result. They can let their, and you can let your employer or schools know that you have that positive test result. That's the way to, everyone can contribute to getting the message out. And overall, we should all be staying home, staying limited to our household, and wearing a mask at all times whenever we're with someone who we don't live with.
Forman, a question. Dr. Megan Rainey of Brown University, CNN contributor, she posted on Twitter that it was very dramatic the other night, the number of individuals coming to the emergency room, but we're not hearing the ages. Now, you're there in the front lines. How old are these people that are being then that they have to stay in the hospital that you're dealing with?
So earlier on in the spring, predominantly we were seeing older people coming into the hospital who were sick enough to be admitted, but now we've been seeing people sort of adolescents and up who are being admitted and who are getting sick. You know, obviously the older you are and the more comorbidities you have, the more likely it seems that you will become seriously ill with this. But like I mentioned with the healthcare worker, there are people in their 20s, 30s, 40s who are becoming incredibly ill and ending up in the ICU. None of us is invincible. No age and no status of health is protective against this virus.
Do you believe, has the virus changed from the virus you saw back in the spring? Because there seemed to be a period of time, there's no one K through 12 in the hospital, there's no young college student in the hospital. You're saying that's changing and the age getting lower?
We are seeing younger people there, whether that's the virus changing or whether that's just people's activity and behavior changing, and that's leading more people to become sick, we don't know.
Can I just change gears just for a second? The aid program that you've offered for restaurants. I heard from a restaurant owner, he said, you know, the maximum's 10,000. He qualifies for 7,000. This is his email. My business will receive about 7,000. In the fine print at the bottom of the application, it says the state is going to issue a 1099, making the grant taxable. In my case, it's around 1,700 all low back. Why would the state be taxing this when you're trying to give as much as you can to these restaurants?
I'll get more.
Yeah. I don't have a good answer for you. I think it's a federal regulation that requires me to do that, but let me get back to you.
Last two, Mike at the top.
I have a question for Dr. Forman. Since you will be the person serving, I understand, as medical director of the Cranston facility, if it has to open, I'm interested in what the next steps are after that. I mean, we would get 350 beds. If we have to open that hospital, we have 600 beds in surge capacity, taking into account surge capacity in the regular hospitals. But what happens after that?
When we fill those
It's certainly possible that cases could extend beyond that demand. And in checking my notes, it seems like an enormous amount of time ago, but I did a story on April 17th in response to Dr. Alexander Scott's announcement that there would be crisis standards of care plans and implementations. And so you would be, I guess, one of the people responsible, if not perhaps the person responsible, for primarily making that call. When do you implement crisis standards of care, which in layman's terms is basically rationing of services? And how likely do you think that is? I mean, obviously that's calling for a projection based upon behavior and inputs that we can't know. But how realistic is that possibility that we will end up effectively having to ration care?
That's a very hard thing to estimate. Certainly, if we look at other places around the globe, there have been other countries that have had to implement crisis standards of care. If we continue in the current trajectory, I'm very concerned that we would need to. We've already had discussions at all of our hospitals about what this would mean, how we would make decisions about who would get care, who would get services, who would get supplies. It is not a thing we ever want to have to come to. Having done that in other countries and refugee camps around the world, that's not something I ever want to see again. But we also want to be prepared and realistic about the fact that this is a pandemic which is growing exponentially in our state. So I can't give you an exact answer about whether or not we will have to do that. We are prepared to do that if it comes to it. We are very hopeful that people are going to take this seriously, that people are going to stop taking risks, stop putting themselves and other people at risks, and prevent us from getting there, because we can, as a population, prevent this. We in Rhode Island can avoid getting to a crisis standard of care. We can avoid getting to a place where we have to make decisions about who gets on a ventilator and who doesn't get on a ventilator. We have the power to stop this and change this. So we are very, very hopeful that people will listen to Dr. Raimondo, or to Governor Raimondo and Dr. Alexander Scott, and make the necessary changes so we don't have to go there.
One of the things that motivated my question was that I read this morning that Idaho and Missouri are not at the point of deciding who gets a ventilator and who doesn't, but they're starting to curtail medical services. Are we at that point again, as we were at March and April?
I can't speak to that. I would defer to Governor Raimondo.
What percentage would you say people that are following the regulations? Because, I mean, you're a doctor. You tell people, don't drink and drive. People do that. Smoking causes cancer. People smoke. Eat a lot of food, you become obese. People don't exercise. I mean, isn't this part of that there are just some people, no matter what you say, or Governor, Dr. Raimondo, or whoever, that the people are not going to follow it? Because there are people listening, watching right now saying, I've been following everything that they've been doing, and yet we're hearing these stories. I'm not trying to minimize, but isn't there just some people, like, don't wear a helmet, don't wear a seatbelt? Like, you're trying to regulate human behavior that just...
Yeah, human beings are difficult to regulate at times. I think what's different here is this is less akin to smoking and more akin to drinking and driving. This is putting everybody else around you at risk. You know, whether or not you choose to wear a mask not only impacts you, but it impacts everybody else. It impacts all of us. It impacts everybody who needs to come to the hospital. It impacts everybody you come into contact with. So I think this is, you know, to not follow Governor Raimondo's recommendations now, to not be careful and not protect yourself now is doing something that's actually incredibly dangerous to everybody around you and incredibly dangerous to the state. So, you know, yes, we do not always do what is best for us, but we are really prevailing on people to do what is best for everybody else around you at this point in time. This isn't, I'm not wearing a mask to protect myself, I'm wearing a mask to protect everybody around me. And that's what we want people to do.
I was going to call her Dr. Raimondo now.
Sorry. Thank you.
But I have a slightly different answer. There's a lot of people who were following the rules who've just relaxed, and they need to go back to following the rules. So, and some of us in this room, which is to say, it's human nature. When we were in the thick of it, people were following the rules. I see it every day. The kids, oh, what's the big deal? Pile 6 of them into a car and go get something, no windows open, no masks on. I'm going to have a little something for my daughter-in-law, a baby shower. We were going to have 30, we'll just have 6 or 7 girls over. No one wears a mask. You know what I mean? So a lot of people were following the rules. Now we've gotten a little relaxed. We got to go back to being strict about this. It's maddening to be up here, knowing we're going to open the field hospital, more people will die, we're going to spend however many millions and millions of dollars a month on that field hospital, and it all could be prevented by such simple things. If everybody in Rhode Island went home today and wrote down a list of 6 people that they were going to limit their lives to for the next month, promised to wear their mask wherever they were, cancel social engagements, we'd be fine. We'd be fine. She's nodding. We'd be fine. So simple. But I don't know. I'm struggling to get folks to make that happen.
What's the status of the other 2 field hospitals?
Well, one, there's no status. It's an empty building. We haven't started to deconstruct the convention center. I put a hold on that, so.
With regard to your I'll call it your vaccine review board, is an intriguing proposition because there's roughly two groups of people who are vocal about their concerns about vaccines. You've got folks who question transparency, indemnification, testing, all of that. And then you've got civil liberties folks who, for example, with the prescription medical database, were concerned about the police involvement in that. Was this decision to do this a reaction to those potential concerns? And are you anticipating holding any type of public review or public sessions to discuss these?
Yeah, excellent questions. So, in part, yes, this was a reaction to that. Look, there's a lot of distrust, mistrust. Everything's become political. Mask wearing is somehow political. The vaccine is becoming political. And I am trying to do everything I can to just get people focused on the facts and the science. And I have found that transparency is key to that. So yeah, we're going to put all the data out there. We're going to put the discussions of our group out there because I want people to have some trust. You can't force people to get the vaccine. To your question, we can't force anyone to do it. I want everyone to do it. So this is all about transparency, trust, and process.
Last question, Governor, Dr. Michael Osterholm is one of the top coronavirus advisors to President-elect Joe Biden. He said that a nationwide lockdown for 4 to 6 weeks could help control the pandemic and revive the economy. He says that interest rates are so low right now that borrowing isn't a bad idea. And by the time we get out of the lockdown, 4 to 6 weeks after that, the economy should sustain itself. Considering where the state is right now, do you believe that the government should head into a 4 to 6 week lockdown and take out money with the interest rates being where they are? Do you feel comfortable with that approach by President-elect Biden?
Well, this gets back to Hummel's question. You know, nobody wants to go there. And I think you can't do it cavalierly. No, you can't just borrow enough money and hope that that keeps the economy afloat. Having said that, the consequences of not doing a temporary lockdown, I think, could be a lot worse. So I don't see the national picture any different than what I'm trying to figure out here in Rhode Island. We ought to try to avoid it. We ought to try to do more testing, yes. We ought to try to get people to comply. I think around the holiday, lockdowns could be well used. If none of that works, we may have no other choice than a temporary lockdown. And if we do that, then the federal government better step up with a serious stimulus because the economy is quite fragile.
And then just real quick, as a follow-up, are you able to say what next year's projected deficit is? Is it $300 million or more? We're hearing it could be double of that.
And it's about $300 million each year for 21 and 22. So it's double if you look at the 2 years combined.
And then as we're closing on that December 31st deadline for the money that you have from the federal government, do you plan on spending that as we get closer to, with more of maybe a clearer picture of how things are shaping up before January 20th?
Yeah, I mean, look, I'm up here today. I'm about to start spending millions of dollars a week on a field hospital. We're going to have to do a lot more testing. That's going to be expensive. They're definitely going to be a lot more expenses than I would have hoped.
Thank you.
Thanks.
Thank you, doctors.
By that, you mean me. Goodbye.
What's the plan?
Say some more prayers. Bye.